patient has no friends or relatives here. The patient's unable to speak for themselves. They're extremely ill. They're dying. They need to have some paperwork, something that designates what you want in those last stages at the end of life. We're all going to be there, and we're all going to have to make those decisions, every single one of us. These decisions need to be made in advance of that last illness. And in fact, this particular agenda has been in law for more years than it has been out. I mean, we just started talking about it, but even in the Bush administration, there was a provision for the government to pay for people over 65 who wanted to go and get an attorney to make out the will, make out the power of attorney for health care, the durable power of attorney for health care, durable power of attorney for their finances, and to make decisions about how they wanted to handle their end-of-life issues. There's a specific form that we called a POLST, or Physician's Orders for Life-Sustaining Treatment. Everyone should have it. It's just as simple as that. Everyone should have it. And the fact that the government is willing to pay for you to go and get it, you can actually get it on the internet. Truth be known, you can get those forms on the internet. You can write it out in pencil and sign it, as long as everybody knows what you want. But the government is willing to pay for that, for you to go to somebody professional and have that done. Currently that has become a big issue, and now they don't know if they want to include it. And if you walked a mile in my shoes and saw the people that I see who are at end of life and need end of life care, and those papers aren't in order, how difficult it is for them to deal with it, because sometimes, even though they didn't want to be intubated and left on life-sustaining treatment, they are, because there's nothing and no one to say any different. So I think that it's quite important that anybody, at any age, I think you need to look at these situations, because none of us know whether we're going to be here today or tomorrow. It's important to do it, and to do it up front and now, and let your family and friends know. It's one of my real button issues, I guess I could say, but it's because of what I do and who I see and how I work. I've worked in public health. I've worked as a nurse for 33 years. I've worked in California, I've worked in Alaska, and I've worked in Oregon. And I have seen people from pediatric care to ophthalmic care, to hospice care, nurse case management, and lots and lots of different aspects of nursing. But here I am at the end of my nursing career, helping people with the end of their lives. And I would like to make it known how very important it is that we deal with that issue, and deal with it ahead of time, so that your daughters and your sons and your nieces and nephews aren't making decisions for you that you do not want and would not want. The decisions really should come from you.
It's working. I'd like to thank everyone for showing up today. Your showing up and showing your interest in this subject is really making a difference. Only a few years ago, if you had any interest in this subject, the only place you could go to read about it were obscure peer-reviewed journals. And because of your interest, it's now in the mainstream media. Just in every single day in the paper, there's an article about healthcare. In today's paper, there are multiple articles about healthcare, and I think every letter to the editor was about healthcare except one. And that was in the Oregonian. And it's because of us, because we're showing that we think this is important and we care about it. And so the media picks up on that. Oh, well, people care about healthcare. Okay, we'll start giving them articles about it. And the politicians go, oh gosh, the voters care about healthcare. We're going to start paying attention to this. this. So what you're doing is important, and I applaud you. In order to get funding to do research on healthcare stuff, it has to be, your research proposal has to be on one of three things: cost, quality, or access. That's the only thing people care about who are funding research, and that's because that's the only things that policymakers are interested in: cost, quality, and access. So as you develop opinions on the healthcare stuff, and you'd like to market or pitch your ideas to policymakers, it would be valuable for you to wrap them into that model. Because anything that you think about healthcare that it doesn't relate specifically to cost, quality, or access will be interpreted as being irrelevant to policymakers. Access is what it sounds like. People talk about, oh, there's uninsured, those people don't have access to healthcare. Well, that's part of it. But there's a lot more to it. You can imagine a little part of Oregon where there might not be any cardiologists, and then whether you have health insurance or not, there's no cardiologist for you to go visit. On page 2 of the Oregonian today, on the front section, there was an article about a shortage of general practitioners. Now, there's been this research that's came out of Harvard. It's been ongoing for more than a decade, and we've identified that we don't have enough GPs, general practitioners, and we have too many specialists. And the article in today's paper, it said it very well. It said that the guy who takes care of you after you've had a heart attack makes a lot more money than the guy whose job it was to keep you from having a heart attack in the first place. So we have a lot of people to take care of you after you've had your heart attack, but not enough people to keep you from having the heart attack.
And by a lot more money, you mean like 5 times or 8 times?
Well, Scott would know about those things. And what the article was saying is if we waved our magic wand and said, okay, everybody's covered, there'd be thousands of people that would go, oh boy, and they'd pick up the phone to get, and they'd start calling the GPs, and they'd be calling all the GPs, and they'd all say, we're not taking any new patients. So they would have an access problem even after we solved the financing problem. Anyway, that's the access part of the tripod. That's not really my area of expertise anymore. I was involved in that research at the beginning of it. All of my research interests now, or interest, what I get paid to do, is I'm interested in anybody who will pay me to do anything. That's what I'm interested in. I don't have any other source of income other than to have people pay me to do research on healthcare. And so cost and quality are the two things that are the things that I've been studying, and cost and quality are related. We look at the level of cost and quality, and we think at the same cost, the same amount of money I'm spending now, can I get more quality? Or conversely, can I get the same amount of quality that I'm getting now for less money? And I was told not to talk about costs because it'll be boring. So I'll just say that our healthcare expenditures are higher than anybody else's in the world, any other developing country. We spend more money in absolute terms. If you divide through by people, our per capita expenditures are higher than anybody else's. If you divide through by the size of the economy, by GDP, we are #1. And, but no researchers have been able to demonstrate that as a result of being #1 on spending, we're #1 in quality. We have good quality care in this country. It's not like our delivery system is broken, we need to destroy everything and start over. You can get good health care in this country. It's just that nobody has been able to demonstrate that we're getting more than other developed countries in terms of what we may not be getting our money's worth there. And again, you know, historically, the healthcare expenditures data, you had to go to the Healthcare Financing Review, a fascinating journal, and they have an annual expenditures article that you would read and say, what are healthcare expenditures doing? When I got into healthcare, we were spending 10% of GDP. Now we're getting close to it. We're pushing close to 1/5 of our GDP. You know, I mean, the thing seems to be out of control. Our costs seem to be out